Hi, this video is the 10-month follow-up, and my friend Chris is kind enough to do a follow-up. And before we continue and have a discussion, I want to show the audience what, and remind the audience what my Chris looked like before. And that was him. It's completely bald, and he has a few straggler of hair, and that was it. And that's before surgery, and now this is where his hair is. And so, 10 months.
Yeah.
It's gone by quick, huh?
So fast.
Yeah, it's you know, people get nervous and they can't wait to get the result fast enough, right?
Right.
So I think the most difficult, would you say the first 3 months or first month?
Yeah, for me it was because you're constantly looking at your hair to see any grass has fallen out or any has started to grow, especially and it's like, okay, but it's like when you watch hair grow, you're not gonna see it, right? And some days you sleep and then you wake up and then you're like, okay, I got some more hair. But yeah, after it starts growing, it was quick. I mean, day by day, week by week, and a month, and it's just so fast. And now here we are, 10 months, and I just can't believe it.
Yeah, that's good. And so, it's interesting. Last time you were here for follow-up for 9 months, I believe.
Right.
And then you actually ran to one of my potential clients.
He was on his way out, and then he saw me, and we started to talk, and I told him, I'm here for a follow-up, and that I was also a patient, and he was like shocked. And I showed him, my picture, the before picture, the one that you showed there. And he was just like amazed. He said, you know what, I came for a consultation, and I just wanted to see, what Dr. Diep could offer, and I really like his work. I was doing a lot of research, but now I'm sold. He said, I'm going to set up a date, I'm going to get my hair done. He said that after he saw mine in person, he was absolutely sold, and he was going to do it. So I was like, wow. He goes, yeah, it's nothing like seeing it in person and stuff like that. So he inspected my hair, and the side of my head, the back of my head, the top, and everything, and then so he asked for my number, and I gave it to him, and he called me and just asked for some questions about my experience, and of course I shared my experience just like I have on these videos in the past, and he asked about my strip method and how did it feel, how many months, just the typical question everybody would ask. And at the end he asked me like, well, is there anything else that you would do differently, or anything that you would do differently? And he actually stumped me there, because my experience here has been better than what I expected. It just exceed my expectations. So he stumped me, and I said, well, the only thing is I would ask for more grafts. 5,200 grafts is already a lot, right? But then I said, oh, I wish I had more grafts. But 5,200 is great, and as you can see, the results are fantastic.
Yeah, well, that's good. And and again, I want to remind the audience that it takes a year for it to fully grow. And Chris here had his result around 4 or 5 months. And the thing that we did to follow up and those stuff, month to month, that helps a lot. And to give the patient a glimpse of what's it looked like during the recovery and during the duckling stage.
Right.
But it's not as bad as people think. And again, the result vary, the growth rate vary from one individual to another. 95%, it would take a year to fully grow.
Right.
You just lucky to be that 5% to get it earlier. And so I don't want to give an impression that everybody's going to have exactly same rate as Chris here.
Right, but the most important thing, like you said, eventually everybody will get there. Actually, you had one video on here that I saw was an older Asian male, and his results were great, right? And I remember on the video he was talking that he came in 6 and 7 months and he barely had any growth whatsoever. And of course that would be alarming for anybody, right? But he came back for a year, and his hair looked like mine. I was like, wow, it looks great, So yeah, it does. Everybody just grows at a different rate. For him, it's probably at 7, 8 months, and it's just started to grow, And within that 3 to 4 months, it grew a lot, and he had a great result as well.
Yeah, I mean, eventually it will be, and again, the result vary from one individual to another. Some people have thicker hair, it will look more dense, and some
Right.
people have thinner hair, will look a little bit less. But overall, with my work, is very consistent. You know,
Okay.
if people subscribe to my channel, you know, once a week I upload a new video,
Mhm.
and because when you upload it consistently every week, not like for once every couple years, it kind of gives them to let the audience know, hey, you know what, I produce consistent result.
Right.
Natural, consistent, and natural density. And again, the result vary from one individual to another. I try to give the audience to get a glimpse and a feel of what it looked like as month by month. So, and the 10th month. And then you get back to that, the 10 month. Recently, you went out with
Yeah,
a friend.
Yeah, I went out with a couple of female friends, actually, a female friend, and she brought her friend along, and we're sitting there just talking, and then, you know, I didn't bring it up, but they kind of brought up, you
One
know,
of their friends, right?
yeah, the, you know, hair transplant, and you know, somebody needed it, and so I said, hey, you know what, I know a doctor that does hair transplant, of course, just you, and I said, hey, I'll be happy to refer. And they said, really? I go, yeah, absolutely. And I joked with them and I said, look, you know what, one day if I start growing bald, I'm gonna definitely go to this doctor because he's the best. And they said, you're never gonna go bald, man. You got you know, a thick head of hair. And then, you know, it was just funny, you know, the comment they made, you know, you're never gonna go bald. You're never gonna need one. Then, you know, and then unbeknownst to them, you know, I had a hair transplant, but, you know, it felt good for them to say that, you know, and they didn't even realize that I had a hair transplant.
And that's a good feeling, right?
Yeah.
It's natural, and
Yeah.
no one
It's undetectable.
undetectable.
Yeah.
That's the very important factor.
Even, you know, and even
It
with,
scares people
Right.
when they get it done because they're afraid, well, people know I've had surgery, right?
right,
Were you that nervous at the beginning too?
just like everybody else, of course.
Uh-huh.
Of course, you know, because, you know, I'm thinking to myself, like, okay, what happened if they could tell that I had a hair surgery because, you know, the hairline is not natural. But of course, you know, like what we talked about last time, where you know, the imperfections make it look natural, you know what I
Right,
mean?
right.
Like, for instance, you know, one side hairline, the hairline might be higher than the other. You know, it just makes it look very natural, and I think that, you know, you did a great job in my hairline. It looks natural. And you know what's great about it is that my friends and people that know me for a long time and know that I lost my hair, and they know that I got a hair transplant because now I have a full set of hair, it's undetectable to them. And that's how you know it's good, because these people know that I was bald, but they inspect my hairline. They said, God, your hairline is perfect, it's undetectable. You know what I mean? It looks so natural. It doesn't look like, you know, it's plugged or anything, how in the past, over 20 years ago, where, you know, it actually looked like doll plugs and stuff like that.
That's scary.
Yes. So, you know.
And then you're gonna be living under the hat.
Yeah. So when people that you know and knew that you were bald, make compliments like that, you know it's good quality work.
Well, thank you. And you know, I take pride in my work, and for me, I focus heavily on the artistry of hair transplant, especially the hairline. It's one of the most difficult to recreate, and especially for custom work too. Because sometimes when you create around an individual facial structure, right? But not only that, but you take into consideration what the patient wants to. And we discuss about, you know, soft hairline, tight hairline, medium tight, and those stuff. So the tight hairline, that's very sharp, and the smaller zigzag, and that's what a celebrity want. And look at me, I have good density, I am very youthful, I'm very handsome, but it draw more attention. Where the soft hairline had the bigger zigzag, use a lot more single hair graft. It looks very natural and no detectability. However, it looks less dense. But then there's somewhere in between, which is medium hairline, so medium tight, and the medium tight. And for yours, actually medium tight, by the way.
Good. Because I have very thin hair, right?
Yeah, and your hair's not, because you're mixed. I mean, you have Asian, you have partial Caucasian. So yeah, you have, even though Asian hair, but you do have not as thick as a typical Asian.
Of course.
So we would do a medium tight to give you the full density look. That's number one. But if you want to push the envelope, just say, hey, you know, I don't want to draw attention yet.
Just do a medium.
Yeah, but I want a push envelope for density. So that's
Yeah,
why.
medium tight's great.
Yeah.
You know, I remember when you first told me about the medium tight, and also the tight, I was thinking, gosh, I want the tight just like the celebrity. Why can't I be like a celebrity, right? But actually now, since you did it like this, you know, it came out perfect for me. And like I said, it looks very natural. So if it was even tighter, you know, I think that will, like what you said, it will draw more attention, right?
Yeah, so again, I build it according to the individual facial structure and
Yeah.
individual personality as well.
Right.
And as long your request is within range, it's fine. But your request is too crazy, then I'm probably not going to do your surgery. Number one, you never do too high where you
Right.
leave a big forehead. It draws attention.
Right.
And you don't want to do the hairline too low where it draws attention as well. You want to be proportional.
Right.
But one best way is to bring your old photo, right?
Right.
When you had it before, and then to recapture that. And your photo, you brought it to me,
Yeah.
and we recaptured that where it was.
And not only did you recapture it, but then a lot of it's your artistic work as well. And I remember coming in here and we sat on the day of surgery, and then you drew my hairline, and you just drew it real quick. You just drew it like this and a couple of other things and grabbed out my head. And I looked at it and it's like, okay, great, and I was just so surprised and shocked at how fast you did it. And that's because you see my hairline, you've done this for many years, and so you have a lot of experience. So you just by looking at my face structure and everything, you knew what the hairline should be. So you weren't sitting there for a long time trying to draw it out and erasing it and drawing out whatever. You knew, and look how it turned out.
Yeah, but it helps that you have old photo, number one.
Right.
Number two, it helps that I talked to you how many times?
Oh yeah, I mean,
Yeah,
I was
10 times.
I was a problem, patient because as Dr. Diep.
You gotta save up and
Yeah. So
and do it right too.
I actually had to cancel a couple times, and so I know that your secretaries probably weren't very pleased with me at the time, but I had to, because work issues and just trying to save up. And now I'm happy that I did it when I did, because you got a little bit more advanced, and things like that. Technology got better,
Right.
and whatnot. But hey, my buddy did it a couple years before I did,
And good job too.
Yeah, and his results were good, and so.
It's again with hair transplant, there's a whole artistry creating hairline, and again I focus heavily on it, and that's what separates my work from a lot of clinic. And so this is the 10 month, and we stay tuned. We're gonna do the 11 months, and after that we're gonna do 12 months, and after 12 months we're gonna do this 18 months. That's
Okay,
a year and a half.
Right.
So that way, so the audience can know, hey, it works, and maybe do 2 years, because they say they want to know, hey, does it
Yeah,
last?
it's gonna last, right? And
Yeah.
I actually done research on that on my 5 years after a transplant or 11 years, and people still have their hair. You got to maintain it.
Yeah.
So.
And it just so it still all depends. I mean, in anything in life, you're gonna have wear and tear.
Right.
And then and the transplant, you can lose up to like 10 to 40% of it, due to aging.
Right.
For me too, when I get older, I'll lose 10 to 40% of them. But however, if you can maintain it by eating healthy, don't do crazy stuff, don't use cigarettes. Cigarette, the nicotine part is very toxic, and it can cause hair loss.
Right.
And not just cigarette, marijuana too, and
Right.
other stuff.
I don't do any of that stuff. So.
Yeah, drugs can affect it, but
Right.
beside that. But I think we touch up quite a bit of topic, and that girl paid a good compliment that,
It
hey,
did. And I don't know if people notice that, but I haven't touched my sides. In the past, I would shave my side or cut my sides and just leave the top, but then I'm deciding just to leave my sides out. I'm not going to cut it, maybe trim around the ears and the back. But my goal is to leave it longer here as well, gel it, slick it back, and whatever. But I haven't touched my top, as you know. I haven't cut any of my transplanted hair, for 10 months now. So.
Yeah, I like to leave it up to a year, because
Right.
so if you leave it alone, let it grow,
Right.
and then you can style it. On the side, you can cut it and shave it, it's fine. But leave the top long to give it volume.
Yeah.
And full growth.
It's not only giving it volume. I want the hair to grow out evenly to catch up, and then when they cut it, everything else is going to be even, because as you know, it's going to grow at different rates and stuff like that. So that's why I'm leaving it long and not touching it, because I want eventually everything to catch up to each other, then cut it all at once. And
Well, it sounds good.
Yeah.
All right, stay tuned. Thank you.